My name is Lorena Bontrager, and this presentation is for Goshen College, my community nursing class. So my presentation is on mental illness in the incarcerated patient. So some statistics relating to this topic. According to a study done in 2014, approximately 15 to 20% of inmates in jails and prisons have a serious mental illness. Now, this does not account for people who refuse to participate in this study, so it's possible that the actual number may be much higher. A quote by Carroll: "The nation's jails and prisons have replaced hospitals as the primary facility for mentally ill individuals," which is very sad. There are nearly 10 times as many mentally ill people behind bars as in psychiatric hospitals. We have the issue of people going to jail for minor crimes, waiting to be treated, waiting for beds at a psychiatric facility, worsening while in jail and not receiving the mental health treatment that they need while in jail. So there are many disparities in incarceration rates. According to Wagner, African Americans make up about 14% of the population in Michigan, but they make up 48.8% of the populations in jails and prisons in Michigan. People born into low-income families are 20 times more likely to end up in prison as opposed to people born into financially stable families. Obviously, this could be for many reasons, but one obvious reason is people who are in poverty may turn to crime to eat. They may turn to drug use to self-medicate. According to Prison Policy Initiative statistics, out of 100,000 people in each group, Black people have 2,207 incarcerated people, Latinos have 966, and white people have 380. That is quite a difference. I'm sure there's many factors that play into that, but according to the information gathered during my interviews, a large portion of law enforcement's interactions do in fact involve mental illness, low-income people, and minorities. So these statistics were all confirmed by my interviews. My interviews were with David Kroc, a police officer with the Kalamazoo Township Police Department, and Patty Kane, a nurse practitioner at the St. Joseph County Jail. David Kroc reports that many calls are related to mental illness in one way or another. He reports frequent interactions with low-income families, minorities, drug abusers, and people with mental illness. Patty Kane has spent her whole career working with inmates through the St. Joe County Jail. Her biggest concern for the health needs of this population was the fact that they do not receive mental health treatment while they're in jail. She said sometimes the community mental health programs don't work with the patients while they are incarcerated. They do have resources once they are released, but she was concerned about the lack of mental health treatment during incarceration. She stated that if they had some treatment and were prescribed medications and were working with therapists during their incarceration, perhaps they would have less rates of reincarceration and would be able to reintegrate into society better if they had that treatment during their stay. My clinical experience consisted of 6 hours at the jail where we assessed the incarcerated patient. I interviewed Patty Kane, I spoke to several corrections officers, and I spoke to the LPN and RN that worked with Patty Kane. I observed the interactions between the inmates and the staff. I noticed that the inmates tended to complain about the corrections officers, but they showed respect and a little more of a relationship with the nursing staff. So I think we have an opportunity that they may not to provide care to these people. I did observe many behaviors of drug seeking and manipulation with the inmates at the jail. Many of them reported symptoms that they thought would end with them being prescribed medications. They attempted to speak to Patty in such a way to get what they want. However, Patty, having worked with this population for years, can really handle her own and did not give in to these manipulations. During my 10 hours with the Kalamazoo Township Police, I observed several interactions with mentally ill people. The first of which was a call to a home where a family was trying to move out from their mother-in-laws, and she had barred the doors and was inside screaming incoherent, nonsensical things. The family reported that this person does have mental illness that's not being treated. They said she has had frequent episodes such as this, and it had gone untreated up to that point. The second interaction was a call for a runaway juvenile. His mother reported that this 15-year-old had bipolar disorder and possibly other mental illnesses. She stated she had been trying to get him in for treatment, had been seeing a psychiatrist and psychologist, but the 15-year-old wouldn't follow up, wouldn't comply with medications, took off whenever he wanted to without calling. So that's definitely an area of concern where maybe if he could receive better treatment and complied, he would have a better outcome. I also observed several different interactions with homelessness and very low income people who, upon observation and reports from the officer I was with, had ties to drug use, homelessness, all tying back to mental illness. My community diagnoses for this population include an increased risk of repeated incarcerations among the mentally ill population related to unlawful behaviors due to a lack of mental health treatment. There is also an increased risk of comorbidities among the mentally ill population related to a lack of treatment and education as demonstrated by poor self-care. There's also an increased risk for drug addiction among the mentally ill population related to poor coping mechanisms due to attempts at self-medicating. So these all tie back to a lack of mental health treatment. Some interventions, better documenting and reporting of psychological signs and symptoms. So that's on us nurses in all our different areas, whether you work on the floor, in ER, in a clinic. If we see these behaviors, we should be carefully documenting them and reporting them to the doctors. Where at the bedside, we see things others may not. And if we carefully document and report these, we can do our part to help them be recognized and treated. We should advocate for these patients displaying these signs and symptoms. Involve social work whenever you think it's necessary, and whenever possible for these patients. When discussing a plan of care with your doctor, social worker, whoever, suggest mental health treatment as an alternative or in addition to jails or rehabs or just simply medical treatment for these patients. A big thing is show compassion and understanding to these patients instead of judgment and criticism, as it is too easy to do. Point this population toward mental health resources. Another thing, remind your coworkers, your doctors that you work with, and the law enforcement that you work with and interact with, that remind them of the mental illness factor you are dealing with when you're dealing with someone difficult and frustrating. And educate your patients on their diagnosis. Educate them on medication compliance and the importance of that. Teach them coping mechanisms and the importance of follow-up with mental health professionals. If they have good coping mechanisms, good medication compliance, and good follow-up, they may not turn to the unlawful behaviors that landed them in jail or prison in the first place. For evaluation of these interventions, obviously this would be hard to do if you are working in ER like me, but whenever possible, and especially for people in clinics, case managers, things like that, make sure to evaluate these interventions. These patients should be able to report back to you that they are taking all their prescribed medications at the proper times. They should routinely check in for therapy or evaluation continuing evaluation by a mental health professional. And the patient should be able to teach back aspects of their diagnosis, coping mechanisms, and their resources that are available for their use. They should have an accountability person to report their progress to, and we should be able to talk to that accountability partner and confirm that they are complying with all aspects of treatment. They should comply with all aspects of their care, as evidenced by no repeat incarcerations and no drug relapses. They should be able to demonstrate that they are turning to the appropriate coping mechanisms and treatments rather than turning to drug use, turning to crime, things like that. So some resources I found while doing this project. The biggest one is social work. They have connections and resources that us as nurses on the floors just don't have. And a huge resource is us advocating for our patients, pointing them in whatever direction they need to, talking to doctors, talking to social work, just managing their care, making sure they're not falling through the cracks. There is an organization called Michigan Collaborative to End Mass Incarceration. There's lots of information on this website regarding the incarceration of the poor, the mentally ill, and minorities, along with what they're doing to fight this. This organization addresses systemic inequality and mass incarceration. They work to decrease the stigma surrounding people who have been in prison and help them find jobs and housing after their release. They work to treat mentally ill people instead of incarcerating them whenever possible. Another program I found is a program called Changing Lives and Changing Outcomes. They work to provide better mental health care and life skills to prisoners to decrease in reincarceration. They address antisocial thinking and behavior patterns. They combine mental health care with practical skills that incarcerated people need to reintegrate into society without being reincarcerated immediately again. And then there's the resource of law enforcement being educated and taking patients for mental health evaluations instead of to jail whenever possible. At Borges, we have a program where the Kalamazoo Township Police are in the hospital every night. This is overtime for them, so it's voluntary, but almost every night we have an officer there. They are able to bring more patients into the ER and make sure that they're safely seen, evaluated, and treated by crisis screeners, social workers, doctors, and evaluated for their mental health symptoms and signs, rather than simply carted off to jail for whatever they were called for. And then I have my reference page. Thank you for watching.